communities are fighting against odds that wouldn't exist in non-Indigenous communities. And as I mentioned in my answer to Dylan, um, we don't have to look at H1N1 where we saw the odds. It's a bit of a pale specter compared to what we're actually seeing in the U.S. in a number of communities. And if you compare communities, for example, the Blackfoot in Alberta and the Blackfoot to the south, the numbers are much greater. So there's things that worked during the first wave, but there's no magic to keeping COVID out of a community. It's vigilance, the adherence to the health protocols, tracking, tracing, isolating, making sure that communities have the resources. But you're fighting against, we're pushing back overwhelming odds stacked against Indigenous communities based on historic inequities, access to healthcare system, poor health infrastructure in communities, as well as the challenges that are faced in urban situations with respect to Indigenous communities, as we see the numbers in ICUs and hospitalizations in Winnipeg, for example. We constantly assess and reevaluate. I think a lot of the ministers that are in the mix and working every day to keep people safe wake up every day and ask themselves how they can move faster to help people. But COVID moves extremely fast, and when it gets into a community, when people let their vigilance down, when economies reopen, this spread is inevitable. But it is not a challenge that we can't overcome. There's some communities like Cross Lake, the military that went into Opaskwayak in their long-term care facility and did some amazing work along with Chief Christian Sinclair. There's amazing work being done in communities. There are other communities that are challenged, and they have to keep implementing their pandemic plans. Some of the measures that we implemented in Indigenous Services Canada, in juxtaposition to what we did in the first wave of COVID, are more tailored and addressing the inevitable surge. We knew this was going to happen, and we warned. We're still fighting those incredible, overwhelming odds, but tailoring those resources, including ensuring communities first have the financial backing of Canada, making sure they have physical resources, isolation units, repurposing common areas like schools and gymnasiums to deal with the surge. And extreme circumstances. And I would say, although every community has a pandemic plan, there isn't really one that plans for the arrival of the military, because these are really catastrophic scenarios. For example, as what we're seeing in Shamattawa, in northern Manitoba. Our approach from the very beginning is to ensure that Indigenous communities are not left behind. And there are unique situations to each community that make tailored measures really, really important. We'll continue to work with them, but this is going to be a couple, 3 or 4 or 5 difficult months as we see the increased stress on mental health during the winter months, as well as the challenges in overcrowding. And overcrowding is a huge issue. Every chief I talk to that has an increase in COVID in their community talks to me about the medical supports they need for their people. And the almost immediate conversation after that is about housing, because if you have one person in a congregate living space that's multi-generational, you're talking about pretty much 19 or 20 cases if they have 10, 15, 20 people in that housing. It's an issue that COVID has brought to the fore. It has existed prior to COVID. We look at Inuit communities where overpopulation exceeds 50%. They have 300 times the rate of tuberculosis, which follows a very similar vector to what COVID does. So you asked me what went wrong. There was already a lot wrong before we went into COVID, dealing with the historic inequities, and those are the cards that were unfortunately dealt, and we're dealing with them. And that means deploying resources of the Canadian government to ensure that communities have the resources they need. That means constant communications with communities that have those spreads, and adapting to the situation at hand, and in ultimate cases, bringing to bear resources that only the Canadian government can bring to the table, including the armed forces.